and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you wanted to talk about the safe use of ibuprofen or NSAIDs.
Right. Non-steroidal anti-inflammatory drug, which
Right.
is ibuprofen fits into that category. And it's very common across the counter. And if you're a type of person that does not like to take pills, and usually our viewers are, that's why you do therapy things, is to
Right.
get rid of your pain naturally through exercise versus popping pills, so
Right.
to speak. This is a really good way to approach acute pain or pain when you have strained a muscle and you know you need to take something, but how long should you take it?
And first off, we're not pharmacists, as you
No.
probably know. We're physical therapists, but you spoke directly to a pharmacist,
Exactly.
got the information. So we're basically just being conduits. We're taking the information and we're passing it on to
Right.
you.
So this is it. There's red flags. If you're an older person, 65 or older, then you may want to consult with your doctor or pharmacist on this. So those people.
Too many issues going on
Right.
at that
If you
age.
have kidney problems, liver problems, you're not going to do it. This is for healthy adults.
Sure.
This is not for children.
Right.
If you had a child, you're going to decrease
Again,
the dose.
And you're going to talk to your doctor about
Right,
that.
and we're not going to talk about that.
Yeah.
Okay, so how many pills do you take? Typically, one ibuprofen across the counter is 200 milligrams.
Okay.
Okay, you can take up to 4, 800. That's a maximum. You don't
Okay.
have to take 4. I usually take 3, but I have taken 4.
That would be 600.
Right, exactly. So
And you're taking it with food. by the
Right.
way. Yep.
Always with
take
food.
with food.
Exactly. And you don't have to have a large amount of food.
But
you
just something in the stomach.
You could snack with it. Okay. So you're going to take, like with me, I'll take 3 pills, and you do it 3 times per day
Okay.
for 3 days.
So every 8 hours or something like that.
Right. Just divide it up throughout the day. When you wake up,
Yeah.
lunchtime, and later on.
And you're doing it for 3 days, you
3
said?
days, and then you stop.
Okay.
If it's going to do any good, and this is a doctor that I had, unfortunately he left, moved to Chicago, but I really liked him and to stay with him. But he gave me this protocol, and he said, this is going, if the ibuprofen is going to help, it's going to take care of it in that amount of time.
So what happens after 1 day, it's feeling better, do I stop?
Actually, he said continue the
For
protocol.
the 3 days, no matter what.
Right, because it's still not fully healed, and it's still going to have some benefits, was his recommendation.
So let's say it's been helping for the 3 days. Can I keep going?
He's saying that
No.
If
Yeah.
it's done what it's going to do by those 3 days, and if you're not that pill-taking type, you're going to say, yeah, that makes sense, and it does make sense to me.
This is really actually very good timing because my wife's going through this exact same thing. She's got her hamstring injury, which
Right.
we've talked about many times, and she'll go out and run, and she just discovered that if she takes ibuprofen that she
Right.
doesn't
Yeah.
have pain. So I'm going to put her on this protocol because, after 3 days.
Yeah, otherwise she may be taking it for
she'll
weeks
just keep
and weeks.
doing it.
And it's hard on your liver, it can
Yeah.
be hard on some cardiac problems.
And it's really not doing much benefit beyond that. is
Right,
what
yeah,
he's
it can
saying.
do more damage
So,
to your system. A nice little trick. This is a little inside secret.
Okay.
Quietly down.
All right.
Okay. Okay. No, I got the jar of ibuprofen, and you put it in
Right.
your pocket, and it makes noise. Just take it out and take a little lunch Ziploc bag and put in a bunch of pills in there. You can put them in your pocket. It's handy, so when you're at work, you can pull them out, and it just makes it convenient. And you know how that can be.
And then if you forget what the pills are, you can go to, there's websites that identify pills. Identify
I take a Sharpie and then I mark on the plastic. My wife called me on that. She
Oh,
said,
on the plastic?
Yeah, I mark it there. Or normally you would put beefsteak and what date you put it on. I put ibuprofen and.
Well, then she probably slips in some other pills to get rid of Brad. That's
That
what I
life
would do.
insurance policy is looking good.
So,
Take care.
thanks for watching.